Hi, this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with Sandy, who came all the way here from northern Arizona to see us. And this is Sandy's 4th treatment out of 6. We started seeing him Monday, and today is Tuesday, so this is his 4th treatment in here, the 2nd time today. And we're going to entitle this video, "This is what you get for $250 at Advanced Chiropractic Relief." Now, Sandy came in here on Monday and we sat down and I did a really thorough history and orthopedic neurological examination on him. Was that thorough to you?
Oh, it was very thorough. He went from top to bottom, checked out things I'd never had checked out.
Yeah.
But it did good. I mean, he really
Well, we dig deep to find out what your issues are.
And I've had problems for a lot of years, and I've been here, this is my 4th time here this week, and I am standing up a lot straighter. I'm feeling a lot better, a lot less pain. Don't knock it till you try it. The price is worth it, trust me. And I wouldn't be here if it wasn't.
Yeah, and you're a truck driver, right?
Yeah, I run
So you sit a lot.
a lot on my butt, and then we do a lot of heavy equipment moving around too, so.
Yeah, so you work for a living. A lot of these people out there making comments about our outlandish fees, they don't even have a job or don't work, and they don't understand, you know, what we do each visit. So I'm going to show them, and you know, you can watch a whole bunch of other chiropractors on YouTube, or you can go to a bunch of other chiropractors' offices. And I want you just to see the difference in what we do here at Advanced Chiropractic Relief. Every single visit on every single patient, I do a before posture exam, 3-dimensional on the X, Y, and Z axes. So I'm going to have you close your eyes, Sandy, and flex your head forward and backwards for me, please, sir.
Nope.
Just your head.
Oh, my head.
There you go. We haven't gotten that part of him fixed yet, but. Okay. I did his reflex on there the other day. It seemed to be okay. Okay. So I am evaluating 3-dimensionally on him on the X-axis, the Y-axis, and the Z-axis what his biomechanical configuration is. Posture is a mirror of spinal biomechanics. So this is like looking at an x-ray for me. You can see his right hand's out in front of his left hand, so he's still sleeping on his side, twisting to the left, and his head's rotated a little bit to the left, and then his pelvis is still shifted to the right on the x-axis a little bit. So that shows me he's got forward head posture, he's got translation in his neck to the left, he's got rotation to his neck to the left on the y-axis, and he's got translation of his pelvis to the right on the x-axis with rotation to the left on the y-axis down here as well. And then you'll always see me doing this on every single patient. I check the leg length, and that is a very important examination to evaluate the biomechanical configuration of the sacroiliac joints and the sacrum. So let's have you lay on your stomach for me, Sandy. And you notice I always do leg checks, and you can see his left leg is shorter by about 1/2 an inch right now in this prone position. Now I bring his legs up, you can see that they even out, and that tightens up in your low back a little bit still, doesn't it, Sandy?
Very much so.
Yeah. So he's still got pelvic distortion, which I saw in the posture exam with his pelvis being translated to the right. Now if you look here, you can see kind of an outline of where he's been sitting on a wallet for years. Now he's not doing that today while he's coming in here. I don't know if he's doing that 24/7 yet or not, but. So when I brought his legs up, his pelvis raised up in the air and tightened up, that's called a positive Nautilus orthopedic test. When I brought his legs up, they got even, that's called a positive Deerfield test on the left, which indicates sacroiliac subluxation complex. So I am going to start off adjusting his left SI joint here. I'm also contacting his hip and adjusting his hip joint simultaneous with his SI joint. Then I move over to the right sacroiliac joint, and I'm adjusting that straight down at a 45-degree angle. And then the sacrum straight down, superior to inferior in P to A. And then I'm on the fifth lumbar vertebra right now, straight P to A. L4 straight P to A. Now some of these are a little sore because he's been out for so many years. And then we're going to get into his lower thoracics here, mid-thoracics. And I am adjusting every single part of his spine to get maximum joint range of motion out of those vertebral segments. Okay, so see, he's still about a quarter of an inch short. So I'm going to go back. I do pre and post check. So I'm not just doing that one time and laying the patient down on their table and cracking on them. We have very stringent guidelines on who we accept as patients and who we don't. Now that's about as close as I'm going to get. It's about 1/8 of an inch off. I'm going to bring your legs up again though. Does this one tighten up as much as the previous one, Sandy?
Not near as much.
Okay, good. So we get him as close as we can on that. I've already adjusted his thoracic spine and got maximum range of motion out of all these joints and break up the fibrotic adhesions and scar tissue formation that forms over time from old traumas, posture, biomechanics, sleeping wrong, sitting wrong, working on computer lots, driving big trucks, lifting heavy equipment. I'm putting the cervical lordosis back into his cervical spine from the lateral view so that we can have a lordosis in his cervical spine as opposed to straightening out or having a kyphosis in his cervical spine. So let's turn you on your back now, please. I do my exercise all day long in here too. Slide up this way a little bit. There we go. Now I'm not adjusting his cheeks, however I am using his zygomatic processes as a contact point to bring his whole head up and back over his spine so that we can put his entire bowling ball head up over his spine as opposed to it being forward and causing increased workloads of the paraspinal musculature and ligaments all the way in the disc, all the way down into the lumbosacral spine. So now, Sandy, we're going to slide down about 1/2 inch and put your arms out like this. Now, I don't know if your chiropractor adjusts all these things all the time, but I'm adjusting bilaterally his AC joints, which is the acromioclavicular joints, the sternoclavicular joints bilaterally, and the costosternal joints bilaterally. You know, a lot of you say on the comments on our YouTube video, he does the same adjustment on everybody no matter what their diagnosis is or their issues are. Well, I am using the same techniques. Now, you should have felt that from your knee all the way to your lower back, didn't you?
I did.
So I'm adjusting his lower extremity now from his ankles, knees, and hips all the way up into his lumbosacral spine. There we go. Good job. Feel that one all the way up too?
Oh yeah.
Okay, let's sit you up sideways and face that way. There we go. Again, now I'm adjusting his shoulder, right shoulder first, but this time I'm adjusting the glenohumeral joint, not the AC joint. I've already adjusted that while he was on his back on the table here with the drop table. Now I'm adjusting his left glenohumeral joint. There you go. Crack addict's gonna love you. And you're a crack addict yourself, huh? That's how you found us.
That's how it is.
Yep. We've redefined the word crack addict, you know. It's not drug addict anymore. It's loving the sounds of chiropractic cavitations. Cavitation is the cracking noise that you hear when I adjust the joints. That's the nitrous gas bubble that expands and explodes and makes a noise inside the joint when I open that joint up to its maximum range of motion. So then we're going to come over here. I'm going to have him lay supine, which is on his back. And we're going to pin him in with these strong new pins that I just got. Side up a little bit more, Cindy. There you go. And I get these pins in there nice and tight. You're not going to get away now, are you?
No,
Okay.
I'm not moving nowhere.
Now bring the legs up to parallel with the floor so that we can relax the paraspinal musculature from the lumbosacral spine all the way up to the cervical spine. Make sure he's right down the center. And I get this wet towel and wrap around his occiput and his chin. Now I'm not choking him with this, nor am I choking any patients with this. I'm not wrapping the towel around their neck, I'm wrapping around their occiput and their mandible. I do a straight vertical, in this case horizontal, but the y-axis, full spine decompression. How far down did you feel that, Sandy?
Clearing my toes.
Oh. And we don't want to sound like Cipriano's patients. You just really felt that down in your low back and pelvis,
Yep,
right? Okay, good.
Yeah.
See, I don't tell my patients say they can feel it all the way to their toes, although they probably did feel that all the way in Arizona. There you go, smooth as silk. That's Palmer diversified rotary brake. So I have now done spine adjustments in his cervical, thoracic, lumbar spine, and pelvis. I've adjusted both upper extremities and lower extremities. Let's step you up sideways. There we go. Okay. Now we're going to stand right here. All right, so I've adjusted him three-dimensionally now, and I'm fixing to top this off with an atlas adjustment so it will send a neuroproprioceptive afferent impulses into the cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement. So we need to retrain his cerebellum how to hold him in this newly configured position. Remember how low that shoulder used to look?
It used to set about 2 inches lower.
Yep, now it's pretty much even, but we're going to show them how we're fixing that still. And we send patients home with exercises every day. Pull your shoulders up and back for me now, Cindy. Yep, like that, and flare these guys here. And then we bring that head here, all the way straight back in the Z-axis. And then he's a little bit right, so we go left. Or excuse me, he's a little left, so we go right, I'm sorry. Now we're gonna look straight back at the wall behind you there, Sandy, and I'm gonna shoot you right there on the atlas. This is a high velocity, low amplitude adjusting instrument. That's how it does, it's not a staple gun. Now, try that again, Sandy, and you tell me what the difference is and how this feels to move your neck this time versus the previous 2 times.
Feels like it's been lubricated.
Yep, put a little WD-40 in there, huh?
The very first time I leaned back, he caught me, I fell back.
Yep.
So the adjustments have been coming a long ways for me. I was pretty messed up when I come in here, but
Well, look at your
It's getting
shoulders
there.
now.
Yeah.
And also, you're not nearly as translated to the right on your pelvis. So I do pre and post orthopedic neurological evaluations, pre and post three-dimensional postural biophysics examinations and analysis. So when he leaves here, I know that I have done everything that I know how to do chiropractically to help reconfigure his spinal biomechanics into a better biomechanical configuration so that his spine becomes strong and stable in gravity as opposed to weak and unstable in gravity. And that's where people get their problems, is when they get vertebral subluxations, their spine gets weaker and more unstable, and then it starts going downhill and deteriorating into degenerative joint disease, degenerative disc disease, cervical radiculopathy, herniated disc, bulged disc, scoliosis, all kinds of different pathologies. So, this is going to be coming from Sandy, He came down here all the way from Arizona, spent the money to travel here, and spent the money to get a hotel here and come see us. And I'm charging him $250 for what I just did that you just watched me do. And Sandy, you tell people how you feel about what you're getting for your money.
You get really well adjusted. He does a thorough analysis to see what you need, and then he works you over. It may hurt a little bit, but I'll guarantee you when you leave, especially the very first time, I walked better than I've walked in 6 or 8 years. And every time I come back, he keeps getting a little better, a little better, a little better. And hopefully, at the end of this treatment, I won't have to see this guy again. If I do, I'm glad to come back. But for the most part, I've never been in this good, ever. I've had back problems for a long time, and it's well worth your money. And don't knock it till you try it. Till you come down here and lay on one of the tables.
And for those people that say I'm doing the same adjustment on every single patient, how would you respond to that?
He's not. Because my friend over here, he's getting the same thing done, and he does me different than he does him. And you'll be able to compare them in the videos because we're both on here. But it's a whole different ball game. It may look similar, but you can see on one person he'll be pushing a lot harder in one spot than he will another. He may go along the same parts of their spine and whatnot.
But I use different angles.
Different angles, different techniques. And you can watch. Sometimes he pulls a little bit, and sometimes he gets right with it. It is what it is, but
Yep.
It's helped me a ton so far.
Well, thank you for sharing your experience with
Thank
everyone,
you.
Sandy. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we practice hardcore chiropractic adjustments of the entire body every single day, all day. We'll see you soon.